And joining us now on Arizona Illustrated for her monthly visit to our program, Dr. Victoria Maizes, the Executive Director for the University of Arizona-based Center for Integrative Medicine. That's the program started here in Tucson by Dr. Andrew Weil. Dr. Maizes, good to see you.
Thank you. Good to be here.
We're talking tonight about women and bone health. And when you talk about women and bone health, the first thing comes to mind is osteoporosis. Is osteoporosis something that is peculiar just to women, or is it something men also should be concerned about?
Well, men also can develop osteoporosis. It tends to happen about a decade later than it happens in women. And so the worst consequence, the hip fractures, are less commonly seen in men. Although as men live longer and longer, one of the unfortunate side effects may be more hip fractures.
Is osteoporosis a natural part of aging?
The answer is yes and no. It is normal for us to lose some bone as we get older. That is a normal part of the aging process. Osteoporosis really is when you don't just lose some bone, but you lose a lot of the quality and the tensile strength of that bone, and as a result you have an increased risk of fracture. Unfortunately, right now, osteoporosis is only defined by using a DEXA scan. It's not defined by how good quality is your bone. We don't have good tests for that at the present.
So if someone wants a test for osteoporosis, they go through what you call a
DEXA scan, that's
right. What
right.
is that? How does that work?
It's a very low dose X-ray that measures the bone density at the hip and at the spine, which are the two areas where we are at greatest risk for fractures from osteoporosis.
And what does that scan then come back? There's, I assume, some kind of parameters.
Yes.
What is considered normal and healthy?
So you'd get back two scores, a T-score and a Z-score. And one of them, the Z-score, compares you to other adults of the same age. The T-score compares you to 30-year-old adults, and it's thought that for most of us, 30 is our peak bone density. So what happens is we reach a peak at 30, and then our bone density starts to come down. And so we compare you at 50 to the 30-year-old, at 70 to the 30-year-old, and to the rest of the population.
And how do you know if you have an osteoporosis problem?
Well, right now there's a controversy about who should be screened, and some people say it should be based on age alone. Some of the societies say screen people over 65. Other people say, well, if you've had any kind of fracture that's consistent with osteoporosis, you should be screened at a younger age. If you've been put at risk for it, for example, if you've had to take a medicine called a corticosteroid, that increases your risk, then you should be screened at a younger age. If you're particularly frail, at risk for falling and fracture because of that, you might also need to be screened at a younger age.
And what about postmenopausal women? Are they suspect to, is this something they should really worry about?
Well, what happens is that at menopause, with the decline in estrogen levels, there's an abrupt fall off of bone. And so we sort of have this gradual loss as we age, but what happens is that at menopause, first we have a more rapid decline, and then it kind of gradually falls off. Men don't have that. They just have a very gradual decline in density with age. So that's the fear that people have around the menopausal period.
So do you think it is caused by low estrogen?
Well, that is definitely the probable mechanism, and in fact for many years estrogen was one of the ways that we prevented osteoporosis, and it definitely works for that indication. It's just that as we look at the risks and benefits of estrogen therapy, the risks, increased risk of breast cancer, increased risk of heart disease, even increased risk of Alzheimer's, appear to outweigh the benefits, which is to our bone health and probably colon cancer prevention.
What about calcium intake? It would seem like that would be the natural supplement for people wanting
Well,
to
calcium's important, absolutely, and the real problem is that most children aren't getting enough calcium. In fact, almost 3/4 or more of girls don't get enough calcium in their diet, which means they're not going to get that peak bone density that they need at age 30. So we do have to pay attention to calcium, and of course it's not just in dairy, it's also in almonds and leaf leafy greens and in figs, and sometimes we have to supplement as well.
How much supplement is necessary?
What I like to do is to calculate how much calcium are you getting in your diet, because in a healthy diet, you get a fair amount of calcium. And then to supplement beyond that, there's a little bit of controversy. Around 1,200 milligrams is what most of the groups recommend. But some of the metabolic studies, and in fact other countries, suggest it may only be about 750 milligrams, which is much more attainable through diet alone.
Yeah, so you may not need all that much.
Correct.
And can you build backbone once it's gone?
Well, I think that you can build backbone to some extent, and you certainly can maintain your bone. There have been some wonderful studies, in fact one done by Tim Lohman here at the University of Arizona, that looked at bone strengthening through weightlifting exercises, and that's often a great strategy. Unfortunately, many of us are sedentary and we don't really load our spines and load our bodies and force them to have the strength they need, and so working out in the gym with weights can make a big difference.
Only about 30 seconds. We always like to bring up maybe a study, the latest study, and this one has to do with women's health, and it suggests the research that lack of sleep really does raise a woman's risk of heart disease.
Yes, it does, especially women who get less than 5 hours of sleep. Their high sensitivity CRP can be elevated, but lack of sleep also contributes to depression, cancer, diabetes. You want to get your 8 hours.
Try so hard, right?
Yeah.
It's tough.
It can be.
Yeah, Dr. Maizes, thanks for being with us. See you next month.
Thank you.
Thank you.